The presentation I did today was on the management of immune checkpoint inhibitor adverse events, and the focus of it was on really managing practical situations, clinical situations that come up in the day-to-day clinical practice, and really the continuum of care, looking at it all the way from looking at the whole patient, from baseline risk factors for immunotherapy adverse events to evaluation of the checkpoint inhibitor toxicity, the immune toxicity, onto the evaluation of and management of that toxicity, and then along with observations. So we're really looking at the patient as they're being treated for the toxicity, and looking at the outcomes and what other things need to be considered besides just the drugs that are given for that toxicity, but also any medications that might be necessary to prevent against other adverse effects, such as infections that can be seen in patients getting steroids for a long period of time. The most common that we see in clinical practice with the immune checkpoint inhibitors is the dermatitis or rash that's being seen. And there is a varying degree from drug to drug and from combinations, and especially with more and more combinations being used of immune checkpoint inhibitors, we're seeing a lot more in the way of more severe adverse toxicities. But dermatitis is the most common. However, based on the drug and the combination that's used, other common immune adverse events include colitis, pneumonitis, and hepatitis are some of the more commonly seen. And that really was the focus of the talk today, was on common immune adverse events.